Don't get paid by an insurance company or other outside services. We only get paid by our patient. And it does vary. My costs are very affordable for most people, and that was my goal, is personalized and affordable health care for everyone.
Hello, listeners. Well, welcome to the brand new season of Doc Talk Live. Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts to answer commonly asked questions. So be sure to send your questions through Facebook Live on Wednesdays by 5 p.m. You can find more information about the show on our Facebook, Instagram, Twitter, YouTube, and our website, doctalklive.com. That's doctalklive.com. Also, watch more episodes of the show on platforms such as Spotify, iTunes, and iHeartRadio. My name is Dr. Mohawk, and I'm hosting today's show. Joining us right now in the studio is Dr. Kane to educate us about the topic of direct primary care. So just to give you a little bit more information about what that is, over the last decade, direct primary care, or DPC, has grown from 21 practices to over 1,000 practices in 49 states, serving close to 500,000 patients. Today's show will answer any questions that you may have about direct primary care, or DPC, which we'll refer to as well. Dr. Kane, welcome to Doc Talk Live. Thank you very much for volunteering your time to be a part of the show. So if you don't mind, tell the listeners a little bit about yourself.
Thank you, Dr. Hawk. So a bit about myself. I'm a family medicine physician, and I practice in Plano. I'm originally from Canada, but made my way to Texas when I was a young adult. Did most of my training here, but had a short stint in Seattle and decided to come home after that.
Awesome. Welcome back. So I guess, you being from Canada, you kind of felt what you kind of deja vu experience last week with everything that went down. You're like, oh, that's the reason why I moved down here,
It is very true. And snow as an adult is very different than snow as a child.
Oh, yeah, for sure. Especially with, freezing temperatures for like 4 days straight. Yeah,
yes.
I bet. All right, well, welcome. Thank you for, coming on the show. Thank you for letting us know who you are. So we'll just jump right into the questions. So I guess it's the same question that everyone's sort of wondering. What is direct primary care, DPC?
So direct primary care, or DPC, is a very simple model of primary care medicine. Direct primary care comes from the fact that we only get paid from our patient. We don't get paid by an insurance company or other outside services. We only get paid by our patient. And it does vary. My costs are very affordable for most people, and that was my goal, is personalized and affordable health care for everyone.
Okay, interesting to know. So how's that different from traditional, the model that we are so accustomed to, this day and age?
Sure. So traditional insurance-based model, I think we see a lot of the same things where patients need to go through different people to schedule an appointment. Sometimes it's difficult to get in to see that provider. And then when they do get into the office, oftentimes there's only 5 minutes with the provider. So what's different here is that because I don't take insurance and I don't get paid by an insurance company, I can base my patient load on how many patients I take care of. So for example, when I left the traditional insurance world, I was in charge of 2,800 patients. And with direct primary care, it ends up being, closer to 400. And so I have more time to take care of patients. So that means time with my patients to talk to them about their disease processes and lifestyle changes.
Right, and I think we all can say that patients want more of our time. And considering that this day and age, healthcare has a lot of, just bureaucratic stuff, sort of paperwork that that can pile up to a certain degree, and that can eat into our time that we can spend with our patients. And I think I think maybe that's probably why the DPC model has caught so much popularity, because of the fact that patients just want to spend more time with their healthcare providers.
Absolutely.
So I think that's excellent.
Yeah, I think it's invaluable, that piece of actually having time with your physician. So I block out an hour for each of my
Oh,
patients,
that's great.
which is completely unheard of
Yeah.
in the traditional insurance model.
Absolutely, absolutely. Like you said, you pretty much have 15-minute slots. And
Yes.
not even that,
Yeah.
right? By the time they come in. So that's good to know. Is direct primary care the same as boutique? Is it a concierge practice, or a boutique practice?
That's a really good question. So, we consider ourselves different as direct primary care doctors. The difference is that our membership fees are usually lower cost, and concierge doctors, usually it's a higher dollar membership. But in addition to that, they also bill insurance. So if you have a high deductible, or you have co-pays or a co-insurance, you're still going to be paying into that. And as a concierge or boutique doctor, they usually cannot provide you with low-cost labs or low-cost imaging, because they have to abide by fair market value.
I see. So, I guess we'll get to that. But a few slides here. So, can you expand on it in terms of, having access to low-cost labs and so forth? I'm sure that's something that.
Yes, and that's something really interesting, and was a large factor as to why I decided to do DPC, or direct primary care. Because I don't sign on with insurance companies, I can directly contract with labs, where they tell me, the cost they would give my patients. I'm able to provide that savings to my patients. A good example is a cholesterol panel. Most typical insurance companies, full retail market is about $77 for a cholesterol panel. At my clinic, it is $10. Same way.
Significant difference.
It's a huge difference. On average, most of the labs are 80% less than the traditional insurance model.
Wow, makes me want to sign up right now.
I know.
So, Dr. Keith, this is all interesting stuff. What made you want to start your own direct primary care practice?
I was with 3 different large healthcare organizations, and, coming towards the end of the last healthcare organization, I was realizing that I wasn't enjoying being a doctor, and I didn't feel very effective as a doctor. I'm a firm believer in lifestyle changes, nutrition changes, changes that you can do to prevent disease process and also treat disease process. And those kind of changes take time, and take time to educate. And I didn't have that time in the traditional insurance model. I was always told, you need to see more patients, you need to see more patients. And I wanted to take that time to actually explain, what does it mean to eat better and exercise? Right.
No, those are excellent points. So I guess piggybacking off of that, what are the benefits of direct primary care?
I think for patients, it really takes care of a lot of their frustrations. So first thing is access and time with your doctor. All of our patients know that they can get a hold of us, and that we will call them back, or email them back, or text them back. And this includes after hours. My patients respect my time, and they know if they need to get a hold of me after hours, they can, and they know how to do that. So that prevents them from having to go to urgent care or the emergency room.
Right.
Just imagine if you could contact your primary care doctor, who knows you the best, knows your health history, when you're having, an urgent medical need, such as, severe abdominal pain that came out of the blue. You don't have to run to urgent care or the emergency room. Also think about, prior to COVID and the pandemic, there wasn't a lot of telemedicine being done. I've been doing telemedicine with this model, since the beginning. So saving patients time and money from not having to leave work or not having to leave their family. The second biggest thing for me is cost transparency. I really believe that everyone needs a primary care doctor, and it really needs to be affordable. And I think we can provide that. And it's amazing to actually be able to tell a patient how much it's going to cost when they leave the room.
Right.
There is no question. And I love being able to tell my patients when they ask me, how much is this EKG going to cost? I love to tell them that's part of your membership, so it's completely free. And then, of course, the common frustrations of not being able to get in to see your doctor in a timely manner. Calling your doctor's office and being told we'll schedule you in 2 weeks from now. And then, the classic waiting in the waiting room for over 30 minutes when the doc comes in for less than 5.
Right. No, absolutely. Can someone with health insurance still be a patient?
Absolutely. So most of my patients have insurance. And what I tell them is, think of your insurance as something to use when you need it for the big stuff. But for the small stuff, it's almost always less expensive and more convenient to pay cash. So, if I have a young adult, and they're paying $75 per month, and that covers all their office visits, all telemedicine, all in-office procedures, they know that that's how much money I'm going to need to save up, plus a little extra for costs of labs or imaging. But then in the back, I've got my insurance in case a big ticket item happens. So just like we have our cars, we have our homes, our insurance doesn't cover maintenance or small problems. The same way should be with health insurance. We need to have something that's affordable to where maintenance and prevention is affordable and something that patients, are paying for and are willing to do that.
Absolutely. No, the transparency element is very very attractive, to be honest. So if someone already has health insurance, I guess you might get these questions as well. They have insurance, why should I have to pay an extra monthly fee?
Yeah, it's a really good question. I think these days most people who have insurance have a higher deductible insurance. Not always the case, but most people do.
Right.
If you're a relatively healthy person and you have a $2,500 deductible, you still make out ahead if you pay a membership fee in addition to your insurance.
Right.
You also know that you can actually get a hold of your doctor and you won't have to search for somebody who is in network. Also, I don't know how many times, when I was in the insurance world, my patients would have to change their primary care doctor because they changed insurance.
Right.
So every year, you never have to worry that I can't be your doctor. And there's something to be said when it's me answering health questions after hours versus a doctor who doesn't know you.
Right.
Such as for example, like a teledoc, I know a lot of people use that service, and I think it's a great service, but imagine if it was your doctor who knows your history.
Right.
It makes a huge difference.
A lot more comfortable in terms of their symptoms and so forth. Yes, go ahead. Sorry.
Oh no, you're good. And the other thing is, I think patients are really looking for help from a physician, and I think patients are tired of being given prescriptions for every problem they have, or being referred to a specialist for every single problem they have. I try really hard to explain to my patients what they can do in their life to treat their illnesses or prevent illnesses, and I really do try to take care of as much as I can as a primary care doctor before I refer them to a specialist.
Right. So I guess you alluded to this earlier. How much does it generally cost? Because I'm sure that's on the back of patients' minds when they're trying to sign up.
Sure, absolutely. Like so for children 5 to 19 years old, it's $50 a month. For younger adults, 20 to 40 years old, it is $75 per month. 40 to 60 is $100 per month, and over the age of 60 is $125 a month.
A month, okay. And what does that, I guess, cover?
It covers all of your office visits, all your in-office procedures. So that means when I need to do an EKG or a lung function test or a rapid strep test or a rapid urine analysis, a rapid flu, all of that is covered. Even things like suturing, lacerations, excisions, or removals of moles, skin tag removals, that's all covered. And then all telemedicine. So unlimited texting, phone calls, emails. And again, it's very interesting, but since patients know that you will respond to them, you don't get inundated with multiple texts or multiple emails from the same patient.
You're not frustrated, or I mean, you know that connection's going to be there, and they're going to call at some point.
And I think we all know that a lot of medical errors tend to happen with transfer of care, right? When information is lost from one healthcare professional to another. So when you have a smaller office and when your patients know that when they call or they text or they email, they're either going to get me or my assistant, it makes a big difference because there's less mistakes and less information that gets muddled.
Right. An excellent point. Is there in terms of a minimum term requirement, like a contract that patients have to sign, like, okay, you know, I'll be good to your doctor for a year, and are there stipulations, anything of that nature?
So there isn't. You know, I want my patients to feel the value in their membership. And so I tell them, you can cancel at any time. I just need a 30-day notice, kind of like a gym membership. And in order to prevent patients from starting and stopping memberships, I do have a pretty steep re-enrollment fee to try to prevent that.
That makes sense. Yeah, absolutely. So, okay. And if we talked about in terms of if your patients need help after hours, how do you normally do that? And I guess, how is it, you know?
Yeah, it's interesting. So I teach my patients at the beginning that if they have a medical question that they need answered by the end of the day, I want them to text me. If they have a medical question that can wait up to 2 business days, I want them to email me. If it's during business hours, again, email, text, or phone calls are fine. And that's how I take care of it.
Yeah. That's great. And how does that, I guess, maybe work on the weekends too? Because that sometimes, can overlap, right, with two days and so forth.
Yeah, absolutely. I mean, a really good example is last week during our ice storm.
Snowpocalypse, yeah.
Yeah, I had patients who were able to text me saying, hey, I can't get to my pharmacy and they don't have my medicine because there's no power there. They're closed. Can you send it to a different pharmacy? And just being able to do that is a huge benefit.
Right, absolutely. Yeah, they're coming up with all sorts of ways to appease customers. I mean, the other day I was just on Uber Eats and I was just looking at, they had a tab for Uber RX. So, in terms of, if you're not able to pick up your prescription.
Oh, that's interesting.
I know, I didn't even know that.
I haven't heard of that
one. Me and my wife were like two weeks
yeah.
ago, oh, you get a great idea. Yeah, they don't have that yet.
Yeah.
No, too late, they do. So, while we're thinking of it, they're already making it. So,
yeah.
So I guess we referred to this earlier, and I'm a consultant as well. So if you, let's say, your patient has a kidney issue or difficult to control blood pressure, how would you refer your patient to me?
Yes. So the way that I refer patients to specialists is by obviously knowing the specialist and trusting the specialist, and I send over a copy of their medical records, and oftentimes I will pick up the phone to talk to my specialist, especially when it's a complicated case.
Right.
I want to discuss it with them. There's a lot of things that are lost in paper sometimes.
Right.
And patients understand that that's when they use their insurance. or sometimes cash pay.
Right.
And patients think they must have insurance in order to get health care. And that's not always the case.
Mm-hmm.
You know, you can get health care. Sometimes you just need to pay out of pocket for that one or two visits,
Right.
you know, with the specialist especially. But if the specialist is able to take care of that problem and control the illness, they can always bring that back to me, and I have a conversation with the specialist, and the specialist says, hey, you know, these are the meds that are working well for them.
Mm-hmm.
You can manage from here on out and contact me if you need me.
And then if they need any labs to be drawn, we can always say, you know, you can go back to your direct primary doctor.
Yes.
And just get them done there, because
Yes.
you know it'll be significantly maybe cheaper than getting it done through insurance,
Yes.
right? Well, that's nice to know.
Yeah.
So, and let's see, if someone is generally healthy or only needs to see a doctor 1 to 2 times per year, how does that work? Do they get to pay per visit, or I mean, is that? I mean, I'm not sure. I'm just inquiring because I'm curious.
Yes, it's also a good question. So I tell my patients, you know, I really want to be your doctor all of the time, not some of the time. And so most medical problems have to be worked through, and that takes multiple visits and it takes time. For the patients who are relatively healthy, I tell them they have a choice. You know, either paying the monthly membership, knowing that I will prioritize time for my patients who are members, versus paying $250 for 1 month of service when time arises, meaning when they need my help. There is that option as well. And I do 1 month of service instead of one visit, again, because most problems take more than one visit to actually solve.
So in terms of a typical day for you, in terms of, I guess, how many patients you see, I'm assuming, correct me if I'm wrong, if on work days from 9 to 5 or 8 to 5, and you have a patient that you allot an hour for in terms of a time slot, so you pretty much have anywhere from 8 to 10 patients if you expand your hours a little bit more.
Yes.
Is that correct?
It's actually less than that.
Mhm.
You know, at the moment, the average is probably, you know, 2 to 4.
Oh, interesting.
Yeah.
Okay, cool.
But I'm not at my full capacity yet.
Right,
And so I
exactly.
do expect when I am at full capacity, I think the average will be about 5.
Okay, interesting. That's great. And you know, I think that brings the whole issue of balancing your lifestyle and not being inundated with, you know, the pressure of seeing so many patients at a certain time. And that's one of the reasons why you went out and created your own practice. So, and your practice is located in Plano, you said, right?
That's correct.
Okay, so you know, we'll definitely have to, you know, get that information and make sure all our listeners know where exactly it's at, because it's interesting, and I think it's a service of just added value that I think patients will certainly appreciate as it's becoming more and more popular. So
Yes.
So on that, so where, I mean, you know, where would patients get more information about you specifically and about your practice?
Yeah. So, you know, I think visiting the Doc Talk website is always a good resource.
Absolutely.
And then visiting my website, mapleprimarycare.com. It also, there's a frequently asked questions tab there, and it really goes over nicely what the value is for direct primary care. And then lastly, feel free to call, text, or email. I usually answer those questions directly, even from people who are not my patients.
Absolutely, that's great. Yeah, no, it's been a pleasure having you here and sort of answering all the questions that we've been curious to ask about what direct primary care is and how the model functions. So we really appreciate your time. We're at this point approaching the end of this episode of Doc Talk Live. Remember to check out Facebook, Instagram, Twitter, and our website, doctalklive.com, to obtain more information about next week's hot topic and guests. So also don't forget to like us on Facebook, Instagram, Twitter, and subscribe to our YouTube channel. You can now listen to our podcasts on Spotify and Stitcher as well. Be sure to send in questions on our social media platforms to get them answered by an expert, such as Dr. Kate. So, Dr. Kainth, any last minute information you would like to share with our listeners this evening?
I guess what I would share is, I think healthcare is important for every single person, and finding personalized and affordable healthcare is a real challenge in our country. So think about looking outside of the box because there are options.
Absolutely. I completely agree with you. I think DPC is probably the wave of the future in terms of your primary care. So this is, thank you for coming again. It's been a pleasure. This is Dr. Hawk officially signing off. Stay healthy, America.